Hi, I'm Mark Houston, the host of Doc Talk, and in this episode, a conversation between Dr. Stephen Tamang, Monument Health physician and director of addiction medicine and community health services, and Brian Mueller, the Pennington County Sheriff. They go deep into the role the sheriff's office plays in shaping public policy, tackling controversial topics ranging from magnet services to ICE enforcement. They take a hard look at homelessness, exploring the services available in our community, the gaps that still exist, and what real solutions might look like. Expect an unfiltered, thought-provoking discussion about the intersection of law enforcement, public health, and the systems that shape our community's most pressing challenges. It's coming up on Doc Talk.
Somebody mentioned that there's a lot of programs around the city that a lot of people don't really know about, and they figured this might be a good opportunity to talk to some people, especially related to healthcare in the community. So thank you. Thank you very much for participating.
No, this was great. I appreciate the invitation to come down and visit with you a little bit about some great things we have going on in this community.
Yes, sir. First thing I wanted to ask, you're an elected official.
I am.
About halfway through your term here,
roughly? I just finished up year 2 of my first term.
So my first question is, how's it going? What are your thoughts?
Well, I guess that's really a better question for you because I get evaluated by the community that I serve. But I feel like things are going really, really well. We have a lot of great things going on in the community. I have an amazing staff. It really makes it fun to come to work every day just to see all the incredible work that they do. And so I just try to work hard on making sure that they have the resources to do the good work they do in the community, and then continue to build the positive relationships that we have. And I feel like we have a lot of key leadership positions that are supportive of each other and work close together every day. And that's one of the big things I really love about being sheriff, specifically in this community.
Yeah. It's interesting. I think a lot of people don't realize, and frankly, until relatively recently, last few years, I didn't realize Sheriff's office does a lot more than corrections and enforcement. There's actually sort of a public health piece and a policy piece to it as well. Can you expand on that?
Yeah, and I think that traditionally when people think of Sheriff's office, you think of law enforcement and the patrol aspect, and we certainly have that, and they're amazing. And but here in Pennington County, we have several things that are unique about the sheriff's office here. And I inherited this foundation that was really started by Don Holloway, who was in office for 28 years, carried on and grown by Sheriff Kevin Tome, who was in office for 12 years.
He's a great guy.
And so for the last 42 years in Pennington County, we've had 3 sheriffs. So having the opportunity to work, behind such legendary people in the field's pretty fun. And like I tell people, I just come to work every day, try not to mess up what they've handed me. So, but very unique in that obviously we run a regional jail, the largest jail in South Dakota, and that comes with a lot of challenges, especially with our federal partnerships that we have, housing U.S. Marshal inmates here, helping keep our region safe, really, which is unique. We run a regional juvenile services center, Western South Dakota Juvenile Services Center, and we serve 7 surrounding counties, but we're one of 3 facilities in the country that house Bureau of Prison detainees, and that's really a testament to the great work that our staff do out there every day. That brings in extra revenue to Pennington County to help us provide more services to our citizens at a break to the taxpayers, which is a business model that we've developed here. We really run the sheriff's office like a business. And then the 4th division that we have that a lot of people aren't aware of is that the sheriff's office actually runs the care campus. Mm-hmm. And we're one of maybe only 2 sheriff's offices in the country that I'm aware of that run a drug and alcohol treatment facility. And that really connects us together with a lot of partners in the community in a way that most law enforcement entities aren't connected, and I really do enjoy that. I think it's a benefit to our community, to the people that we serve, and then also I think it is a big benefit to public safety that we have a little bit of control over those valves and the services that we're providing to make sure that the way we're doing it also helps keep our community safe.
I definitely want to talk more about Care Campus. You said something there that I did not realize. You said we're the largest jail in the state?
Correct.
Give me a sense of scale.
Well, we're pretty similar in size. Minnehaha County Jail is pretty close to the same size as our jail. Ours is just slightly bigger. But we are in the process right now of needing to do an expansion here. Our jail has been at or above operational capacity since 2014, and we have about $35 million worth of infrastructure updates we need to do in the original jail that was built and occupied in 1988 and 1989. So that's going to be a heavy lift for us here, but we're working on, the commission just gave me authorization this week at the commission meeting to head out into the community and start holding community meetings for educational purposes and to get feedback on the scale of this project, what it should look like here in Pennington County, and then also to meet with our partners in Fall River and Custer County that we house for, and the city of Rapid City, obviously, who's our biggest customer here. So we have a lot of moving parts with the jail that you're going to see over the next few months, but I'm really excited to get that feedback from the community and start moving this project forward because it's much needed.
2 ignorant questions for you. Number 1, what do you do when your jail's full and you have people that need to go to jail? And then number 2, is having a jail that's large, is it good for the city in some ways?
Yeah, it lets us do a few things. And like I mentioned earlier, we run the sheriff's office like a business. So we do house U.S. Marshal inmates. But a lot of places that have federal contracts bring inmates in from other parts of the country. We don't do that here. We're housing inmates for the federal government that have committed crimes right here in western South Dakota. So I do think that it plays a major part in the safety in our community too. But a couple questions you asked. One, what do you do when the jail's full, right? And the only relief valve that I have as sheriff when the jail gets full is our paying customers, our U.S. Marshal inmates, and providing services to our surrounding counties that we do. And because our local jail population's been increasing incrementally over the last several years, we've had to kick out the paying customers, so to speak. So we've taken the U.S. Marshal inmate population from about 240 that it was a little over 2 years ago down to, I think we're running 114 in custody today. So I've said when I was elected sheriff that talk to the Rapid City Police Department and let them know that I didn't want them making decisions on the street based on whether they felt there was space in the jail. I had the same conversation with State's Attorney Laura Retzel, and said, don't want you making prosecution decisions based on how much room we have in the jail. And I had the same conversation with our judges in our circuit and said, please don't be making hold and release decisions based on how much room we have in the jail. That's my job to sort that out. So the cost of that, though, is we've kept space available so we could do what we needed to do for public safety. But the cost of that to the taxpayers is each 50 U.S. Marshals that we kick out costs Pennington County about $2 million in revenue. So there is a cost associated with that. So this jail project to me really makes sense with the timing of it. If we can add some capacity at the same time we can fix our critical infrastructure needs, we can bring some more of those paying customers back to help offset the operational cost of the jail, which is a lot higher cost long term just in the capital cost of building a jail. So there's a lot of reasoning behind doing that, but I feel we've been doing what we've been doing with our capacity in our jail is making good decisions to keep the inmates and our staff safe, so not getting overcrowded. We haven't done that, but we've used that relief valve of the U.S. Marshals to keep that spot where it needs to be operational, but still keep our revenue line high to save the taxpayers money at the same time.
I imagine that revenue is difficult to come by in your line of work because it's principally a service that keeps people safe.
Right.
So a revenue line probably adds a lot of depth to programs that you would want to run that without it you couldn't. So that makes a lot of sense.
Yeah, and so my budget at the sheriff's office, we collect about 46 to 47% of the total budget is offset by outside revenues that we run through business streams that we've, Sheriff Holloway started, Sheriff Tome expanded on, and I've continued to work on and expand in my 2 years.
That seems really smart.
Yeah, seems that way.
As the population has grown, has the jail capacity also grown, or have you been stuck? I think you said since you've been full since basically 2014, 2015. We've grown a lot since then.
We have continued to grow, and our local jail population has gone up, and then we've just systematically, slowly reduced the number of U.S. Marshals as our local population has gone up.
Okay. So when you're talking about the jail expansion now, if this goes kind of the way you're hoping, what'll that look like? What's the staging of that, and what's the end game there?
Well, right now we've been working for the last couple of years with a building project team, a design team. We've hired Skull Construction as a construction manager at risk earlier or later last year, and we've been working together on the right design to be able to build this next jail tower expansion in phases. So each floor of that expansion would add about 148 beds, and we have the footprint down there at the jail to be able to add 4 additional housing floors, and then 1 floor would be mezzanine for HVAC and mechanical space. But the real decision that I think that our community needs to make going forward is what type of an investment do we want to make on this next stage of this project? How much of this jail do we want to build in? We have the option to shell in future space that we could build out later. So really, that's the decision that the county commission is going to need to make this year yet, as how big of a project do we want to take on here in Pennington County? How many beds do we need to add now, and what type of space can we shell in or afford to shell in, so when the county continues to grow, we don't leave future generations with a price tag that they're not going to be able to afford on the jail space.
What's your opinion on rate, on if you could design this thing? What's ideal from your perspective?
Well, I think it really makes sense to at least build the entire shell. When Don Holloway built our original jail that was built in 88, 89, they built that with the option to be able to add an additional 4th floor on top of that structure. But when he did a jail expansion project in 2005 and 2006, it was actually cheaper to build a 4-floor jail annex than it was to add 1 floor on top of an existing structure. So I think we should work to shell in what we need for future space here, and then I would like to at least add 2 floors of housing, so to add just under 300 additional beds here. That would let us empty out some of the existing jail to be able to fix some of the critical infrastructure that's been failing in that facility, and then also allow us to be able to bring a few paying customers back in to offset the operational cost of the jail. But it would set us up for the future. It'll set future generations up, our children and our grandchildren, when the need arises to finish the additional floors on the jail. It'll be at a much more manageable cost than if they had to actually come in and try to build the jail out over top of an occupied structure, which is really difficult and going to be very expensive.
Are we seeing any trends here locally as far as, I don't know, the term we use in medicine is like length of stay. I don't know if that's appropriate here, but
right.
The sentencing durations, prison versus jail, transfers, are we seeing trends going in any direction here?
Yeah, and we refer to that a lot of times as case processing. So from tracking a case from an initial arrest all the way through final disposition of that case, whether they're found guilty, innocent, sentenced to jail time, sentenced to prison time. And we've done a lot of work. And obviously, as sheriff, I don't have control over that number. That's really something that comes down to court processes, judges, state's attorney's office, public defenders or defense attorneys, and strategies that they have. But it's something that we track, and we're actively part of trying to figure out how can we make that process shorter and more efficient. And I think that our partners in the criminal justice system have been working hard on that for the last few years. The length of stay, we are seeing that it has gotten longer. Cases are a little bit more complicated maybe than what they used to be, but also the type of people that we're holding in the jail are a higher risk inmate than they used to be too. We've worked on a lot of diversion projects here over the years through the state's attorney's office, some through the sheriff's office, and we really track as to which of those diversion projects have been successful. How do we expand on that? If they're not, how do we transition away from that? So I think we've done a good job of taking a look at our jail population, trying to determine, do we have people that aren't a danger in the community that could be housed alternatively? We've done a good job of that, and we're to the point now where the people that are in the jail are really the ones that need to be there for our community. And the only other relief valve we have is to make that case processing more efficient, to shorten the time of stay in the facility. So we do have some work to do in that area, but we have great people that are rolled their sleeves up and that are diving into that.
When you say diversion, one of the things that comes to mind, I'm not sure if it's applicable, but like drug court kind of stuff like that, is that been something that's been successful? Are there other diversion programs that you would shout out as things that, hey, we're doing this right, or we're working on these, or we have some cool ideas?
And we have a variety of specialty courts, and I guess I probably wouldn't get into the specific efficiency on those. I do think that they serve a relatively small number of people, but I think they have a pretty high success rate. But it is costly for the number of people that get to go through that process. So that's something the court has continued to work on. But the state's attorney's office has a few different diversion programs. They have really good track the success rates. They have good success with what they're doing. Some of the other diversion programs that we have are the 24/7 program that's run under the sheriff's office. And, I would tell you that keeps a number of people a day out of the jail.
I love that program. Just plug that, yeah.
Yeah, it's a great program. I think at times we've maybe overutilized it for areas that it wasn't really meant to do. I don't know how overly effective 24/7 program is for monitoring people out on a bond or sentenced on drug violations, but we've had, I feel, really high success on the alcohol-related offenses that we've had, and I get a feedback from the clients that are on the program too that sometimes that's the only thing that's helped keep them from drinking.
It actually is a deterrent. Yeah, it's something that they find encouraging. That's been my experience with it. Maybe that's something worth expanding on. Can you just kind of tell us what that program is? I think that's a cool example of something that's sort of innovative. It serves the patient or the client and the community at the same time.
Yeah, that's a program that was really developed right here in South Dakota by Attorney General Larry Long a number of years ago. And it's run by sheriffs across the state in partnership with our other criminal justice partners, the courts and the state's attorneys and the public defenders. And there's twofolds. One, they can use it as a condition of sentence. So if somebody is sentenced for a crime that has a drug or alcohol nexus, they can have a sentence component where they have to either show up and blow into a breathalyzer for PBTs once or twice a day, or come in and do a number of urinalysis tests, usually by random tests. And I think we're doing those 2 or 3 times a week right now on the random drug tests. And then the other part is as a condition of bond. So if you've committed offense and the courts feel like they want to give you an opportunity to be out in the community on bond, but there's still a risk of that based on alcohol and drug use, they can make you come and report to 24/7. So we can monitor behavior and drug and alcohol use when somebody is out on bond in the community. And that part I feel we've had real success with.
Yep. Common sense kind of solution.
Yeah.
I want to talk to you about healthcare in the jails. My numbers here probably aren't super right. I've got somewhere around 600 to 700 beds in the jail, something like that.
Yeah, we've right at 601 beds in the main jail. Yep.
Okay. And then as far as healthcare, where do you feel like you're at as far as delivering the kind of healthcare you're looking for? Because obviously it's on a spectrum of how comprehensive you want to be, whether it's like we're going to cover emergencies, all the way down to, hey, we're going to make sure we get some preventative, standard healthcare issues. Where does the jail kind of stand in that regard?
Yeah, I think that when you talk about medical services provided in a jail, people's minds go in a lot of different places. But it really comes down to we have a statutory obligation to take care of people when they're in our custody. And there's a lot of different philosophies and ways that sheriffs across the country run their medical programs in their jail, and I'll just use Pennington County and Minnehaha County as an example. In Minnehaha County, they contract their medical services from their jail to a third-party provider who hires the staff, works in conjunction with the sheriff to set policy. Here in Pennington County, a number of years ago, we actually hired a medical director who's a medical physician. It's a part-time, usually a quarter-time position that we hire to oversee policies and practices. And then what we've done the last few years is we've hired certified nurse practitioners to actually run the day-to-day medical services in the jail, provide the clinics. And the two that we have right now are absolutely phenomenal. Our Dr. Tachek actually is our physician who oversees jail medical. He's pretty new to the program, but he's come in and hit the ground running. He's been a really good partner for us. And then we have Rachel Waddell and Michelle Maher, who are our certified nurse practitioners that handle our day-to-day. And I'd put them side by side with anybody that's doing jail medical in the country. I think a lot of places have come to look at what we've developed here as a model. When we look at the cost of what we do here with our medical services, I think we have 22 full-time medical providers, LPNs, RNs. We have some med passers, EMTs. We have a variety of different positions, and really we've had to stay flexible on the types of positions we hired, just based on it's pretty tough to compete with people that are offering $10, $20, $30, $40,000 sign-on bonuses. For the government's not going to be able to compete with that. So we've worked hard to with our staff to provide a really good atmosphere for people to come and work where they feel like they're really making a difference. And it's the front lines of providing medical service to a lot of people who, frankly, unless they're in our facility, they have not taken care of themselves. They haven't made great decisions with the health care, and now they're in our facility, and we have some real crises that we have to deal with. So I think the staff that we have in place right now are providing high-level triage care to make sure that people's conditions don't get worse. And we do things that we have dental folks that come in and provide some services in the jail, but we're not whitening teeth. We're not doing things to that level, right? We're not trying to spend an exorbitant amount of money to let people do elective surgeries and those types of things. It's really triage medicine, helping stabilize people. So when they get released, which over 90% of the people that come through our jail are getting released back out in their community, they're stable at a point where, they can take care of themselves and transition that medical care back out into the community to keep themselves healthy when they're not in our facility.
There's a couple of interesting, conditions that I think jails sort of serve as a unique catchment point. And nationally, this has been written up. I think hepatitis C historically has been like one of the big ones. If you find it, potentially, if it doesn't cost the county a ton, it can be treated and cured, which arguably has a lot of added benefits to the community, opioid addiction and some other addiction-related issues. Have you explored those avenues at all?
I think that our medical staff is very in tune with that, and also what's going on, with providers outside of our facility in the community, and how we can triage that, and what part do we play in the overall health of our community. I think that's on the forefront of a lot of the work that they do. Yes.
Yeah, and I imagine it's challenging because I suspect a lot of your clientele aren't necessarily super eager to engage in things. They're not coming to a clinic seeking help. So
right.
It's a different perspective too. But it is interesting, and I think there's actually from what I've seen, a lot of federal programs that incentivize those types of services too. So it's always interesting to think about, because if someone's in a way lost their rights and they're identified to have a certain curable condition, and they would have the stability in the environment to get that condition treated so they wish, it's nice to be able to pull that lever, kind of take care of those those issues. And I'm sure Rachel and Travis and all are working on that. But it's interesting. So overall, it sounds like you're happy with the current. It sounds like you're very happy with the current level of healthcare at the jail. Is there anything you're thinking of trying to optimize, or
I think something that a lot of people don't realize is how connected our local healthcare providers are to the operations that we run at the sheriff's office. Specifically, the jail is one piece of it. The juvenile services center is a little bit different but similar. But really, the care campus is a big tie-in to how do the people that are coming in and out of that care campus interact with medical providers, and how can we, one, make sure that we're providing the right type of treatment for those people, but we're not doing things that are contradictory based on what's going on out in the community versus the services they get when they come through our facility. And just to give you an example, since we've moved the care campus, it's been operational for about 7 years in its current location. I think when I look at the referrals that we get, we've taken 148,000 admissions into that facility in 7 years, which is a lot of people coming through there. I think it's 9,000 individuals, so it's not 148,000 people. It's about 9,000 people, but we get a lot of repeat people that are coming in and out of there. But almost every one of those people has a connection to either mental health or healthcare in our community. And I think of, when I look at Monument Health specifically, I think Monument Health has referred about 6,000 people to the care campus in that 7 years. So we have a tremendous amount of overlap. I think we've done a good job of connecting our providers together. Obviously, trying to determine in the jail what services can we provide in the jail without having to send somebody outside. So we've developed some things as far as being able to take x-rays, integrate in with Monument Health's lab to get labs done, those types of things, to try to save on the number of people that actually need to get sent to the emergency department versus what we can do in-house as a cost savings, but also to reduce the security threat. Each time you take a high-risk inmate outside of the jail, it increases the threat for them to potentially escape or harm people in the community. So we're very mindful of that. But I think that there's a lot of connection and a lot of overlap. There's certainly probably things we could do better, but I really think that we have the right people in the right place to continue to work on those issues, save the system money, save taxpayers money, but also provide better care for the people that are transitioning in and out, either the correction side or the care campus side in our community.
So I think this is a really important segment that I think a lot of people don't quite have clear in their mind. I think most people in Rapid City that are involved and have cognition of kind of the programs, they know what care campus is. They've heard the term. I don't think a lot of them understand that that's run by the sheriff's department,
right,
as opposed to just some nonprofit or maybe even Monument, but it's run by you. It has multiple components, and these are not incarcerated people. These are just folks that are in various degrees of a situation that need assistance with. Tell me about the parts of Care Campus.
Well, I think sometimes you got to go back and look a little bit at the history of it. And the history part of it is interesting to me. And I might have these years off just a little bit, so I'm just going by memory. And a lot of this was before my time. Most of it was before my time at the sheriff's office. But I think if you go back to the early 1970s in Rapid City, the Rapid City Police Department, I believe in around 1972, 73, actually ran detox. It was run under the police department. I think it started with like 44 detox beds. Since then, it's transitioned all over the place. In the mid-70s, it became a different program that was run by the Pennington County Commission. At one point, that went back under Rapid City Council was running part of the program. In the early 80s, it was actually ran by Regional Hospital, by medical people for a short period of time. Then it transitioned to a private entity because it's not a money-making. Providing services to chronically inebriate a lot of homeless people, there's
Not a good
there's
ROI.
there's not a good way to make money on that. So it wasn't a good fit for the private sector for somebody to try to come in and run it. And in the mid 80s, I believe in 1986, Don Holloway was sheriff. He worked closely with the city council, the chief of police, and the county commission to get an understanding that if you don't have the right facilities set up to handle the types of people we deal with on a day-to-day basis at the care campus, the relief valve is the jail. Mm-hmm. And people weren't really interested in running that. So what was happening is it's not against the law to be homeless. It's not against the law by itself to be inebriated. But without the right services in your community, when law enforcement is dealing with somebody who is homeless with some minor behavioral problems or is inebriated in the community and they don't have the right facility, they end up in the jail. And like I talked about earlier, we've worked hard to make sure that our jail beds are reserved for people who are dangerous in our community, and I think we've done a good job of that. But that care campus facility is so integral in making sure that we can get people diverted into the right area for whatever services they might need that are not a danger to the community. So the sheriff's office has run that since 1986, and I think it's been a really good partnership. And actually, it's a partnership with the city of Rapid City, with Monument Health. A lot of our key players in the community work closely together with us. I think we have connection to roughly 25 outside entities that provide services in the community that are connected to the care campus. So we've worked hard to try not to duplicate services and really focus the services at the care campus on people who have issues with alcohol and drug use, and tried to keep that there. A lot of the community at times has wanted us to be a homeless shelter. We're not a homeless shelter. We do provide services to homeless, but only if they have substance abuse issues. So we focus hard on that, and I think that that's a good relief valve for the jail because we don't have those low-level offenders plugging up jail bed days, critical jail beds that we have to kick out people, marshal inmates who have committed murder and serious felony charges to make room for people who are, under the influence and homeless in the community that don't have another resource. So I think it's a cost-effective way, and a lot of people look at what the budget of that facility is, and they think that we spend too much money on it. But we work hard on keeping the services focused to what we need to be providing in the community in a cost-effective way that isn't sending people to jail unnecessarily, but also in a compassionate way that isn't where we don't have people freezing to death under the bridges in the community too. So we've got a part to play in all of that. Over 50%, over 60% of the budget at the care campus is provided by Rapid City. So they're tremendous partners. The chief of police and I talk frequently. Their staff are very engaged. They have staff that work out of the care campus in the quality of life unit. The mayor is very engaged. The city council is very engaged, as is our county commission, on what services are we providing at the care campus and are they right services for our community.
Last week, I was at the Mission. The weather right now, they're using it as a warming shelter. Patient, client, comes up inebriated. There are certain rules. You can't put an inebriated person in with a bunch of people just trying to stay warm.
Right.
They said, you have to go to care campus for a safe bed. And the thought occurred to me, it's freezing out there. It's cold.
Right.
What would happen if care campus wasn't there? What would happen if safe bed wasn't there?
Well, I think what would happen is people would freeze to death. I mean, we save lives. Our staff down there save lives. And I would tell you the staff that work on the detox and safe bed side, and just to walk through the quick services that we provide down there, we have safe beds, which are literally a mattress on the floor where people can check themselves in. I think the last I looked, over close to 64% of our overall admissions at the care campus are self referrals. So people can come push a buzzer and say, I need help. And we do require that they have alcohol in their system or drugs in their system because we don't want to be a homeless shelter. So we're providing that service for those people. But without the ability for them to self-check in, a lot of times what you deal with is they become a law enforcement issue. They're a call for service for law enforcement, a call for help, and then they're in the back of a cop car trying to figure out what do we do with them. So we provide a really essential service for public safety, as a lot of our referrals into the detox beds, which is a higher level of care than a safe bed, where they get counseling services. If they check themselves into a detox bed or they're placed on a hold on the detox side, they get fed, they get showered, they get clean clothes. So it's a higher level of care. And what we've tried to do with the safe beds, which is a mat on a floor, we don't provide food if you're in a safe bed. We don't even provide blankets. So what we do is provide case management to try to check people that are using that just as a safe place to stay in the community, the option to check into a detox bed, get a higher level of service. But a lot of the people in our community are not interested in that. And so previously, before we had safe beds, we were plugging up our detox beds with people that had no interest in meeting with a counselor or changing any of their behaviors or improving their quality of life. So we've created that harm reduction model of safe beds as a way to keep people from freezing to death, from being victimized out there in our community at a low cost to the taxpayers, and then continue to use our community partners and resources to try to influence these people to make better choices and changes in their lives. We've had some success, but over the course of this last 6 months, we've actually reduced the number of safe beds because I feel there are people that are in there that have other options that are utilizing that service that could be making better choices and need to be making better choices. And as we move into the spring, we're going to continue to reduce that service systematically through feedback from the community and feedback with our partners to get that safe bed number to be the right number for our community. But I think we have to be careful that we don't just expand a variety of services across our community that invites people to come and live here and use resources that are not from this area. And that's something we've worked hard on also.
In your view, on the average person who's being turned away from an emergency shelter because they're intoxicated and safe bed is their only realistic choice, what are the odds that they would turn to criminality in the event that safe bed wasn't available?
Well, it wasn't that long ago. Safe beds wasn't an option for us, and I would tell you that people would do things to get the attention of law enforcement to get picked up because there weren't other options in the community. So it wasn't that long ago. It's probably been, we've had the safe beds here for 15 or 16 years. We've had a variation of that here, but before that I can remember that being a pretty frequent thing, that when the weather got cold and crummy, that people would act out in a way to get law enforcement's attention so they could get picked up and placed in a detox bed. That was a real thing.
They're desperate, right, at that point. They're cold,
right.
And so they it's the most logical solution at that moment. Not a good long-term solution, but at the moment.
We've really worked hard. This year, I believe that almost every entity out there providing services to homeless people came together this year in a really concerted effort to be strategic with our resources and be on the same page. Our communication is better than it's ever been. I think the services that we provide to people are better than they've ever been. We don't have a lot of overlap. We're not duplicating services, which makes me happy. But I think as a community, we need to continue to look for ways to systematically reduce some of those services. And the mayor and I talked last year on trying to partner together to reduce the number of homeless people in our community. But I think keeping the right services for the right reasons in the right areas will help with that. But we have to be very targeted, very specific, and continue to work together. But I think our community, I think there's some capacity to reduce these services even a little bit further and try to influence people to make better choices for themselves, so we don't add to the homeless population and we don't add to the cost that our community, our taxpayers are currently paying to provide these services.
So you're alluding somewhat to kind of the magnet effect, like if you have certain services, it makes it more palatable for certain folks to potentially come to the community to utilize those services.
Sure.
When you're talking about Rapid City, South Dakota, and you look outside and it's freezing, and you compare that to other potentially more favorable areas for homeless, how do you think the magnet effect applies in our community? I think everyone has been very careful to not create an excessively welcoming environment for bad behavior, or for certain types of behavior. Maybe that's the better way to say it. But I think the magnet effect is something worth considering. And I'm just curious, do you feel like it's more of a theoretical concern, an actual concern? Is it happening, or are we far away from it?
So I think that if you talk to a variety of different people based on, where they live, where they do business, if they own a business, where that business is, you have a variety of different opinions on that. What I would tell you is, if we don't do things right, that definitely would be a problem for us, I feel. If we just opened the gates and provided a myriad of extra services, people are going to come. We're the only community, probably West River, that provides these types of services. So we do get some people that are from other communities that show up here. But I feel what we've done a really good job of is connecting together with all of our area service providers to identify people that show up here from out of the area, from out of the region, and get the right resources plugged in with them early. And we do, as you've seen in the news this year, we do buy bus tickets. We do help people get back to the communities that they came from, where their support systems are, because if they come here for whatever reason and they have no support system and their behavioral problems, that's a big issue for us. So we've been very guarded against that. I wouldn't tell you that it never happens, but I think our system is set up in a way that we can identify those individuals, and we have many layers, from law enforcement to Barry Tyson, his folks at Pennington County Human Services, to our staff at the Care Campus, to the staff at Monument Health, to all of our local nonprofits that provide these types of services, to identify those individuals and help them get back to whatever community they came from, where their support networks are. But I do think we get influx of people from time to time back and forth that are transient between Rapid City and the reservation, and from some of our neighboring counties. But we work hard to identify those people and make sure that we're not getting that magnet effect specifically from other parts of the country. When that does happen here, it sticks out, and it's very problematic in a short period of time, and that's something that we're very guarded against.
And I think that's wise. I'm fortunate enough in my role to have a pretty decent degree of oversight into a lot of these patients, and it's been my experience that their global functioning is probably not high enough to say, hey, Pennington County's got a pretty nice mat on the floor, and if we're here, we're going to be taken care of. It is, in my view, it is a theoretical concern that we have to be careful of. I think as a community, and I'd be interested in your opinion, and it's great to have a disagreement if that's where it is. In our community, I think we err a little more towards the fear of the magnet effect than the reality of it. Because in my view, you got a certain population and they fall out of stability for various reasons: drug, alcohol, mental health, sometimes bad luck, sometimes poor decisions. But if those services aren't there to catch them, then you got kind of an ethical problem. Now, if you go a hard line and you say those services don't exist, you won't have those people around anymore, but then you've lost a degree of compassion as a community. So there's a balance. And I think from what I've read nationally and from what I've seen locally and having engaged with a lot of these patients, it strikes me that the magnet effect, we're pretty far from being a destination source for the homeless, for the downtrodden. Just my view.
Yeah, I wouldn't disagree with that. But I would also say, if we were not very careful with the services that we provide and we weren't tuned into that, I think that would be very real here in a very
absolutely.
short period of time. But I just like people to understand we are aware that can be an issue, that could be an issue, and as much as much influence as I have on that. We're trying to be guarded with that. But you also have to come at it from an area of compassion. Once people are here, we're not going to close the door on somebody that's here and needs services. We're just going to work with them to try to make sure, are they here because this is where they live, this is where their support networks are, or is there a community that they're from where they have more of a support network that we could get them back to and still continue to keep those services. A lot of times it's related to mental health services, in my opinion, or chronic substance abuse issues, obviously.
And it's funny how many people get stuck here. I'm working on a program with Monument. We call it our patient-centered medical home, where we sort of tack on to some of the folks that ask for help, but they're very poor in global functioning and have a lot of issues. It is not uncommon that they're like, hey, I have family in Colorado. I have a stable environment. I just can't get back there. And in those scenarios, we have to verify that they're safer there. But then we can provide support for getting them back. And that's good for them. That's good for their community. That's good for our community. That makes things work better. So I have yet to encounter folks intentionally coming here for some other secondary gain. But I agree. Like, if you read any of the Housing First studies and you kind of look at some of the societies that have created, housing options for anyone under a certain threshold, those can be very, very mixed results. You can end up with a lot of trouble really fast. And I'm grateful for the resources we have, because when you're actually practically taking care of these people, if SafeBed didn't exist, you're in trouble. Like, then you're scrambling to buy somebody a hotel room that isn't properly vetted to take a hotel room, and you're worried about all that stuff. And then you're worried about those folks getting taken advantage of. So I'm super grateful for Care Campus and the services that it renders. And I think everyone out in the community, from like navigators, community health workers, a lot of the nonprofits that deal with this, we're grateful for it. I will bring up a question that happens frequently with safe beds. There are patients that say, well, they won't let me in unless I'm intoxicated. So they presumably become intoxicated to enter safe bed. I don't think this is entirely true, but it's a persistent rumor, and there's some people that I'm sure take advantage of it in that way. What are your feelings on that?
I feel like if we do a good job on keeping the right capacity for the right populations in the community, and we have a really good relationship with our partners at the community, or the Cornerstone Rescue Mission, and Lisa Allison and her staff over there. And what we specifically started doing this year is working on communication with the admissions folks in both facilities, that if they get somebody that's past a limit that they're comfortable with drinking, they call, we work on transportation, we get them to our facility. If we get somebody that shows up at our facility that says, I need a place to stay and I haven't been drinking, we work on communicating with them and getting them to their facility. So I think we have the right capacity. Where you run into issues that I've seen are people that don't want to follow the rules, because we have rules in our facility at the Care Campus. You can't come in there and treat staff poorly. You can't come in there and destroy our facility. And we've had people do both of those in the past, something that we've really cracked down on. You can't go to the Cornerstone Rescue Mission and be intoxicated to the point where you're a danger to the others around you in that facility that are just there trying to have a safe place to stay. You can't be abusive towards their staff. You can't be destructive to their facility. So where I see the reality of it is, if somebody shows up and they feel like they have to drink to get in the Care Campus, it's because they're not willing to, and they haven't in the past followed the rules for the Cornerstone Rescue Mission. So their places in our community are limited. But I think that should be intentional and on purpose. And we have really focused on that with the folks that used the Care Campus this last year, that as the sheriff, I'm not required to have safe beds. not required to have detox beds, not under the sheriff's office. So if you want to have that type of resource available, and you want to take advantage of that type of resource in our community or utilize those services, you need to follow the rules. And what I found is we've underestimated people's capacity to understand what the rules are and to follow them. And when we started enforcing them very strict in the last few months, I anticipated that we would have a list of people that were not welcome in the facility. And right now, I'm not aware that we have anybody on that list. They've met our expectations, and they've followed what we've asked them to do. And that doesn't say occasionally when somebody's intoxicated that they don't make a good decision. That's not what I'm saying. We have an avenue to deal with that. If they want to come in and be assaultive to our staff or disruptive, they find themselves in jail. But what I would tell you is we don't have a large group of people utilizing the care campus that are destructive to the facility and assaultive to the staff. They understand that that's not following the rules. And I think the Cornerstone has done a good job of laying those rules and expectations out to people in our community. Yes. And as the sheriff, what I would tell you is we should not expand services in our community for people that are not willing to follow the basic rules that we have for those two facilities. So people that come and say there's a group of people that are not able to be someplace safe when the weather gets bad or those types of things, and they want to expand those types of services for those individuals that are not willing to follow the rules in the other facilities, I would just say as a community we need to be very smart about how we're doing that. And I don't think that government should have to provide all of those services. If there was a private entity that had a good model for providing a lot of the services we do at the care campus and could figure out how to fund that and sustain that, I would be supportive of that. But I'm not supportive in creating a place for people to go that aren't willing to follow the basic rules we have in our current facilities. And I think as a community, we just have to pay attention to that. And when people are coming in and going to city council meetings or county commission meetings, or a lot of times getting on their social media platforms and saying, hey, this is dangerous and we're not providing the right services to people, we should be willing to ask why are they not willing to follow the basic rules we have in the current facilities. That, by the way, when the weather gets cold, we're not turning people away. When the weather gets crummy and it's life-threatening, we'll put extra people in the Cornerstone Rescue Mission. We'll put extra people in the care campus. We do that, but I would tell you we should just be careful not to expand those services for a group of people that may not be willing to follow the rules that are going to be a bigger public safety risk to our community.
Yeah, and I think a lot of the criticism comes from folks that don't really have full insight into the practical. I think take a tour of Cornerstone and Care Campus and see how those systems operate on a regular basis, and I think that would quiet up a lot of the concerns. Because in my view, and I think this is just factually true, it's a unique setup we have here, and I want to talk to you about kind of what I think of as sort of a continuum of care for homeless folks. And interesting philosophical question, just from the start. What causes homelessness is a very interesting question. I myself have evolved on my reasoning of, if you'd asked me 20 years ago, it'd be a very different answer than a decade ago, it'd be a very different answer now. But as someone who, I think you've put a few years in the sheriff's office,
yep.
As someone who's been through all that, what's your view of what causes this in the majority of people, knowing it's multifactorial?
Wow. That's a deep question, Doctor. I think obviously there's a lot of different factors that relate. A lot of the people that we're seeing in our facilities that are homeless are impacted by mental health. They're impacted by substance abuse, a lot of times a combination of both co-occurring disorders. And I think that as a community, we do a really good job addressing that. We do have a group of people here that has historically, part of our homeless population are people that maybe don't suffer from that, but they're voluntarily homeless. Some of the people that use services, not a lot, but some people that utilize services in the care campus have a house in the community.
Yes.
Or they have a house
somewhere
at
else.
Pine Ridge.
Yes.
And they choose to be here, and they like the lifestyle. They like the social aspect of that. Some would say there could be a cultural component to that. I would let people more educated on that go into detail on that piece of it, and I think we have some of that. There's a myriad of different reasons that people are homeless, and I think we do a good job of focusing on the people that are impacted by substance abuse, are impacted by mental health. And then I think we have to really look at the people who are voluntarily homeless living in our community. What type of services are we providing for those people? Because some of them could be working. Some of them could be making different choices to where they would not need to be dependent on government resources or churches providing meals and those types of things. And that's something that I've worked on at the Care Campus, specifically at our safe beds. And we did this more when it was nicer out, and we'll work back into it again this spring, where we required some of the people who were in our facility using safe beds to come help clean up around the campus a couple of days a week. And we started off with really low participation in that. And I went down there personally, and a lot of our staff have spent a lot of time with this group just talking through, this is a service that somebody's providing for you. You could help out. And we developed a sense of pride in some of the people that were coming in to come help us pick some things up in the mornings, early in the mornings before they left the facility. And I think that's something we need to build and expand on in our community, that if there are people who are voluntarily homeless that are using resources, how can we capture that and have them help offset some of the costs or do things that are needs in our community for the services that they're getting? I think that's a fair question to ask, and I think that as a community we should expand on that.
That's a great avenue. One of the epiphanies that I had I'd just say growing up professionally in this, my values and where I would want to see my life going are not shared by all, especially, or I would say specifically in the case of folks who are in crisis. When you or I suspect, and the average person, if we found ourselves homeless, we'd have a very different set of priorities. And once I made the realization that those priorities are not shared, that changed my thinking a lot when it came to how do I be a compassionate, helpful community member, because you don't want to give people things that they don't want. It's a free country. And then the other side of the coin is you want to be effective. You want to help people reach the kind of potential that they're aiming for and to stay out of criminality. But it doesn't share the same values that make sense to the conventional thinking. And so that was a key piece when addressing homelessness. And I think we've seen that play out in some very well-intentioned, very expensive projects that have gone around through the country. So when I look at our community, Rapid City particularly, I really feel like we've done, I shouldn't say we, the people before us and a lot of the people currently serving have done an amazing job creating several layers. I think from the emergency shelter side, I think Cornerstone does a fantastic job. And it kind of goes all the way up. In your view, when you look at the players, and if you had people in the homeless continuum that were being cared for in different capacities, what comes to mind as the most meaningful services that our city offers?
Wow. You're going in the deep end of the pool today.
Yeah,
I like
it's interesting because when you think about it, if you can wrap your head around it, and it's hard, and I don't think many people can because for one, they don't have exposure to the people.
Right.
And then number two, they don't really have exposure to the services. But for, I think, people in our position, and I think for the selected people that are listening that might be actually interested, like how does a patient actually navigate this stuff? And I'll just sort of lay out a little bit of a framework, and I'd be interested in your feedback. I see the emergency shelter game as pretty strong in our community. Unless you're behaving particularly egregiously, I feel like you're going to get taken care of in Rapid City. And if that's going to be from a law enforcement identifying you and say you need help and we're going to get you to the right spot, which would be an emergency shelter or perhaps care campus. And then I see we have a lot of other social programs, Journey On and others do a lot of logistical work. I see One Heart as having a specialized role in trying to get folks who are kind of like close, on their way. I don't know, in your opinion, what's missing? What could be done better? What do you feel like is potentially low-hanging fruit to improve that process?
I think what we do a really good job of are people who find themselves homeless or in a crisis situation that don't want to be there. They know that they want to do something different, and they're willing to ask for help or go to the right service where they can get some help. I think our community does a really good job transitioning those people through till they're back on their feet. I think where we struggle still is what do we do with people in I call it voluntarily homelessness, and I know that can be offensive to some people. There's probably a lot of terms, but what do we do as a community for the people who could make other choices, who aren't choosing to do so, who are living here, who are voluntarily on the street? They could make other choices, and their day right now consists, a lot of them, into going down, holding up a sign, getting enough money from passing by motorists to go down and buy alcohol, and then contribute to the problems in our community by their behavior. I think, to me, that's the low-hanging fruit. And what I would say is that's not easy, because just having that conversation, it'll draw a lot of criticism, and I'm okay with that. But what I've been asking people to do in the last year is quit being critical and come get involved. Mm-hmm. I'm not okay with driving by a dozen people on the way to work that just came from the care campus that are holding a sign saying, "I need anything for help." And there might be, I'm not downplaying that there might be somebody in that group that legitimately wants and needs help and does something productive if somebody's willing to give them $5. But we know that a majority of those people holding those signs that get money are going straight down to buy liquor with it, and they're going to be back in the care campus or in some other facility needing services in our community. And I think it's low-hanging fruit, and I think the people that want to be critical of that should quit taking alternate routes to work every day and drive by it every day and look at those people and say, is that what you want for people living in our community? Is that how you want to treat our community members every day, is by enabling that behavior? Mm-hmm. And I think it should be low-hanging fruit for all of us to say no. So can't we come together on what are other alternatives we have other than enabling that lifestyle in our community? And I think this year we should dive into that. And it's going to be controversial, but let's roll our sleeves up and get to work on it.
That's how you make progress. I was in Sioux Falls months ago in their downtown, and I noticed a lot of signs that said, "Don't give money to panhandlers, give it to organizations."
Yep. And we have those throughout Rapid City too.
Oh, really? I haven't noticed those.
Yes,
okay.
I actually have one hanging on my jail. But no, that's something that some of the city council and county commission partnered together with here a few years ago with some, downtown Rapid businesses and other entities, and you'll see those signs throughout our community too.
And there's a balance there, as you alluded to. It's interesting because I don't know, you would be the expert here, but I don't think it's particularly illegal to ask for money in certain capacities. It's not illegal to be an alcoholic or to be homeless. So at what role does we just say that's a fragmented segment of the population? We're here when you want us. Otherwise, we just sort of give you the freedom to do your own thing. I don't know.
Yeah, that's a tricky one. I know that's something that the police department and the city council have struggled with the last few years of what can and can't you do with that? What part of that is part of the freedoms that we get to experience here, and what part of that, can we say no to as a community? And I don't have the perfect solution to it. I just think we've got a lot of good people willing to get to work on tough issues in our community. That should be one. as the weather starts to get a little bit nicer this year and we're not as worried about people freezing to death and those types of things, that's it should be on our mind. We should be doing the right things there. But what can we do this spring that'll make Rapid City and Pennington County safer and maybe help those individuals make better choices about what they're doing with their time and resources?
Yeah, it's I don't want to dwell on this too much longer, but I was talking to Amy Iverson, BMS West River Mental Health, CEO, and we were talking about the role of trauma in homelessness. And this was something that I think has kind of become pretty popular in terms of the etiology or the cause of homelessness. And the idea is that somehow throughout their development, they may have experienced mind-altering trauma that goes beyond what we would typically consider drug and alcohol problems or mental health issues to really create a situation where what we would say are bad choices or not the principles we would follow. It actually seems rational to them. And then there's a lot of trauma-based therapies and interventions, which arguably, depending on who you trust or who you believe, can have help there. So I'm hopeful that something along those lines might serve as something valuable in the future. And then I'm also hoping that, gosh, if we could become more effective in our pharmacology for some of the mental health conditions, and maybe utilize the things that we have a little bit better. There's a lot of injectable neuroleptics nowadays that can keep schizophrenia under control. Of course, patients have to agree to those injections. But those are avenues in the future that I hope we can deploy nationally, but locally too. I know, there's a number of programs working with the mobile medics that are, because they're pretty well trained in these sorts of matters and they encounter these things on a regular basis. That's another great program.
That's amazing.
It's another great program where they can actually, with partnership with Monument and a prescriber, they can actually inject neuroleptics on the field for patients that, like, hey, you haven't had your shot in 45 days. You're clearly actively psychotic at the moment. You want your shot, and the patient gives consent. They can actually inject those things. So I think there's a lot of things that we can do. I think it's frequent that we kind of just get comfortable and sort of give up a little because it just seems so overwhelming.
Right.
But a lot of things that we can keep working on, and a lot of new people working on it too. So it's exciting.
Could I interrupt just for a
yes,
second?
Sir.
I love the fact that you brought up the trauma-based. I mean, that's a real thing for a lot of people in our community. I don't have the expertise to get involved in that, and nor do our staff at the Care Campus. But what I've tried to create is, and maybe this will spark the interest of a listener, is if you have an idea as to how to positively impact people that have suffered that type of trauma and you want to get involved, come see us. Come partner together with us in the community. Other than just saying, quit being critical, these people have suffered a trauma, let's find some people that are willing to come in and partner together and work on some solutions related to that trauma, not ignore it and continue to let another year go by where people that have suffered trauma are being, judged and talked about negatively and receiving a lot of services. Come plug in next to us at the Care Campus and provide some services for the people that have suffered that trauma and try to make an impact.
Yeah, that's a great point. I've discovered your office is very open to and I've actually noticed, surprisingly too, the city is pretty open to just phone calls, inquiries, and they get routed to the right people.
Yeah.
So just concerned citizens that maybe want to contribute, they seem to get heard. Versus
opening up another shelter that might duplicate some services, let's take people that are willing to work together. Come work with those of us that are already in the front lines doing the work.
Yep.
And I'm open to that. We're not doing everything maybe exactly how we need to be doing it too. If people have ideas and suggestions as to, our operations, our policies, our practices, what that should look like, I'm open to those discussions. But I think just stop being critical and look for a way to plug in, let your voice be heard and be part of the solutions in the community is what I would throw out. And the other plug that we just didn't get into yet, I just want to throw a plug out to the great folks over at the Pivot Point.
Yes.
That's been a pretty phenomenal new addition to our community the last 2 years. We're run by West River Mental Health, and they do phenomenal work for mental health, those facing mental health crises. And I think here, even in the last 6 months, getting the right partners around the table to talk about how we're delivering mental health services to people in our community, I think 2025 has a lot of potential for improvements in that system, probably cost savings, but also improving the way we're providing those services to individuals in our community and their family members that are suffering mental illness. And I feel really fortunate that we have the right people at the right place here in Pennington County that are willing to work on that, because that's an important part of our public safety in our community and the well-being of our community, to get that piece right. And we haven't always done that.
Yeah, and as someone who uses Pivot Point on a very regular basis for a number of people, I can tell you that it's an excellent program. And that's an incredibly ambitious idea too. It would be very easy to shoot an idea like that down. So it was exciting to see it get off the ground, as you would expect. There's challenges as it builds out, but I agree. I think 2025 is a great year for it. I feel like the other services at Monument Health and others are more in line with how Pivot Point works now, and how we can work together. And just so folks who maybe aren't aware, it's sort of a short-term spot where a patient can literally pivot to their next service that they need, and it's for behavioral health crisis. So if you have someone who's not necessarily meeting the full-blown psychotic break sort of thing, but is having significant mental health problems, needs to go to a treatment facility or needs to get into a safe environment, Pivot Point can hold them and for a number of days, and they have staff. So it's kind of like a boiled down, you could almost say like a mental health center, an inpatient mental health center, kind of boiled down to a transient area. So that was a great, ambitious idea. And it was very great that we were, as a community, were able to take that risk, because big risk, it's not cheap. But to give it a try. And I think it's starting to bear fruit. It has been bearing fruit, and I think it's going to get better as time goes by. And so while we battle all those processes, procedures, trying to get people where they need to go, we're also fighting fentanyl, synthetic opioids, and methamphetamines. Where are we at in those battles?
Well, I tell you, methamphetamine continues to be our biggest struggle here. And although we did see a slight reduction in the amount of methamphetamine arrests and cases this last year, it's not where it needs to be yet. It's still our highest driver of violent crime in Rapid City and Pennington County, and I'd tell you probably across the state, talking to our counterparts in other sheriff's offices and police departments across the state, definitely the biggest driver in violent crime. So I'm not telling you we have that solved, but we do have that going in the right direction. Regardless of where you're at with politics, I will tell you that securing up our southern border will have an impact on that for us.
Yes.
And I'm very, very hopeful that we're going to continue to see that ramp up and make it a little harder for people to get that product into our community, because it's hard to deal with in the quantities that it's coming in right now. But we are, we're at war with that entity. The folks that are bringing that in, the folks that are distributing that to people in our communities that are, killing people and wrecking lives. And so that's not something we're going to back down on. But fentanyl is a real deal. We're not seeing the explosion of fentanyl here like they've seen in other parts of the country, but it is on the rise. I think we've done a better job as a community to help family members and those struggling with fentanyl addiction be a little bit more attuned to life-saving measures if they're using that type of drug. But our fentanyl arrests, our seizures, cases have gone up pretty dramatically the last 2 years, and we're going to continue hitting that challenge head on.
Yeah, when it comes to opioids or fentanyl, there's pretty useful pharmacology. When it comes to methamphetamines, nothing is even close to blunting that effect. And the dopamine surge people get from meth is unparalleled. So controlling source is critical. Give me a sense, in terms of the jail, how much do you feel methamphetamine in particular in relation to the other substances, alcohol, and I know you don't have to be precise, obviously, but how big of a role is it for the incarcerated population?
Oh, I'd tell you, meth has a big role in that, and I would tell you, if we figured out a way to get statistics on the people that are currently in jail for violent crime, I would tell you I feel that the methamphetamine contribution to that is high. Overall, the greatest contributor to our jail population is alcohol here still, I think, just based on what I see. But methamphetamine, as far as with the more violent crime, definitely has a significant impact. But I would tell you, I don't know the specific percentage, but I would guess we're in the high 80s, low 90s for a percentage of people that are in jail for decisions they've made based on methamphetamine and alcohol abuse.
Yeah, it's the same. So the hospital, again, I would say alcohol use disorder remains the most dominant, but meth is behind, right? Not too far behind that. So it's nice to see that we're making progress on that. And then as someone who kind of follows these numbers nationally, I think we're going to continue to see improvement. I think people are getting better. I think the prevention stuff is working finally, and I think and that's not just control of source, but I think actual education is actually starting to have an effect. If you talk to some of the younger generations now, they're a lot smarter than they used to be about this sort of thing.
Well, I think we took a break from prevention in our country, to be honest with you. And you remember all the commercials that I had growing up, on the meth stuff, and then for a while, because we're in that business, the prevention dollars dried up across the country, and we got away from that. And this is the drug issues are not something that we can just use enforcement as the only tool for.
Right.
We have to have prevention is key, getting it back to people at the right ages so it's effective. And I think you hit on that. We're headed in that right direction, but we need to put more resources into prevention still, education, prevention, and then treatment. We have a number of treatment beds that go unfilled each day in our community, and I have people in the jail that would benefit from those, but we have to work on creating better avenues for people that want treatment to get them in. Every treatment bed in the state of South Dakota should be full every day, and it's not. And that's troublesome to me. And forcing people into treatment court-ordered isn't super effective. That's a tool that we use, but how do we get people who, while they're a captive audience, whether they're in prison or they're in county jails, how do we get people to that stage where they're willing to accept treatment, and how do we get them into those beds? And that's something I've looked for 2 years for a program that's effective in the country at that, and I can't find one.
Yeah.
And we need to develop that here. And we've been brainstorming that the last few weeks as to how do we work on developing that program in the Pennington County Jail to get people excited and interested in treatment, and then how do we get them into a bed to impact that. So if people want to get involved in that challenging endeavor, I would ask you to reach out, because we're looking for experts that are willing to roll their sleeves up and dive into that. It doesn't exist. Let's develop it here.
And that's sort of it's a fundamental question. It's sort of like we have treatment resources. We have a huge population that needs them. How do we effectively utilize what we have? And we could talk a long time about that. I don't want to bore everybody to death on that topic, but I do want to bring up a couple things that I think are worth noting. It's expensive to put somebody through treatment.
It is.
It's a state-funded, typically, deal with the Division of Behavioral Health, so it's costly. And we also know that there's abuse of that process, because some people seek treatment to stay warm and to get shelter and to get food. So there's this secondary gain that's associated with it. And then for others, it's a life-saving treatment where people get back on track, and it's wonderful. I wonder what your opinion is on more fellowship-related groups like AA, like Oxford Houses, sort of pure run but nationally recognized groups.
No, I think that definitely there's a need for that. Personally, people that I've known personally, not just through work, who have had family members that are specifically, addicted to methamphetamine, the ones that have had success, almost all of them have gotten to the point where they utilize one of those types of programs. Not all of them, but a majority of them, and very few of them right here.
Yes. I have sent hundreds of patients to what's called ASAM 3.7 facilities. So those are like groups where you go for a month. And I like them. I'm not here to criticize them. They do great work. But I can tell you that is an incomplete piece to getting someone into treatment. I've been very pleased with AA. I have found that the people that commit to that, not for everybody,
right,
but for the people that commit to that, it is incredibly effective. And they'll tell you with pride, saved my life. And I'm discovering the same sort of thing with Oxford Homes, because it's almost like it's a degree of peer support and accountability rolled into one. And the thing that you love about Oxford Homes, it doesn't cost the city or the county a cent. They run self-governed, just under the same laws that you and I live by. And so my view is we need more of everything, but we really need more of the self-governed, properly run programs like AA, like Oxford Houses. I think there's another one I'm not as familiar with, but I hear good things, New Beginnings. These are areas that I feel have huge benefit. And they have national data. It's not like these are entirely individualized, So I think that's an area that'll be exciting. And then I think we need to do better on the way the treatment architecture looks over the state. I think there's so much improvement. I think the health systems, we're trying to do better. We're trying to do better at recognizing the illness in the hospital, because they're not there for that. They're there for some other life-threatening problem. We need to identify it as a significant comorbidity, get the treatment started, at least talk to them about it. This is something we've been working on a lot, and then get them to the right facilities thereafter, and then ultimately, hopefully plugged in to something that's long-term and sustaining. I don't want to keep you too long, but I do have a couple more little things that I think the people asked me to ask you about. With the federal enforcement stuff, there was discussion of ICE in the area and cooperation with local law enforcement. I don't know anything about it, so I'm just going to leave it there and see what your feelings are.
Sure. And we have a good relationship with our federal partners here in South Dakota, and we've been in contact with ICE, and as everybody knows, their rules have changed, and if you're working for ICE, your job looks much different today than it did a month ago. And that we're seeing some of that here too. What I think that they're doing here, specifically in Western South Dakota, I've been in really close contact with the folks that run their operations out here, is they're focusing in on the criminal element. So if you've been committing crimes in the United States, in Pennington County, and you're here illegally, they're looking for you, they're making arrests, and they're sending people home. And I can tell you that that's happening. And in the first week or so, they roughly had about 10 detainers. I think that they ended up transferring them out of our facility the following day. And in the last week or so, we've had about roughly 10 more here in the second and third weeks. So they're actively out there finding people that are committing crimes, that are here illegally. They're putting them on detainers, and they're shipping them out. That's happening. So
you don't see anything particularly disruptive for the immigrant community or for the general population if you're not particularly on the criminal side?
I haven't heard of anything out here in Western South Dakota that's concerning to me on that.
Good.
I mean, there's a lot of worries, and you hear a lot of stories of things that are going on across the country.
Yeah.
And we've just, Chief Hedrick and I out here have stayed really closely connected to our federal partners to see, ask them to let us know what they're doing, what that looks like, and I haven't seen anything on those lines that concern me yet.
Fantastic. 2025, what's the biggest thing you're excited about?
Oh, I think the key relationships we have across the spectrum that are excited and interested in making our community safer, better place to live, work, and raise your family are exciting to me. So there's a lot of different fronts. I am excited to figure out what this jail project's going to look like for us. And for the first time since COVID, we've gotten our staffing numbers really stabilized, I feel, this year. So I'm really excited for our staff not having to work the tremendous amounts of overtime that they've had to work, being super short-staffed the last few years. So we've made really good progress there. And I think just partnering together with the Rapid City Police Department, our other state and local agencies, Box Elder Police Department, to just make sure that our strategies are not contradicting each other, working closely together with the state's attorney's office and the courts to increase offender accountability and keep our crime rates on the decrease, which we've had for the last 2 years. A majority of our crime rates have continued to drop since COVID when we had our spikes, and I'm just excited to continue to work together to make our community more safe.
Sheriff Mueller, thank you for the conversation. I speak for a lot of people. We're rooting for your continued success.
Thank you. Appreciate you having me on.